All right, let's dive in. We're going to break down one of the most common and honestly one of the most misunderstood health conditions in the world, high blood pressure. But we're not just talking about some numbers on a cuff. Nope. By the end of this, you are going to see the hidden mechanics behind this silent pressure in a totally new light. And this, right here, is why we need to talk about it. It's called a silent killer for a very good reason. You know, there often aren't any warning signs, no obvious symptoms, until really serious, maybe even irreversible damage has already been done to your heart, your brain, or your kidneys. That's exactly why we need to look under the surface. So what is it really? Well, in the simplest terms, it's just sustained high pressure inside the pipes of your circulatory system. I want you to think of it like a plumbing system in your house that's running at a pressure way, way too high for its own good, 24/7. And here are the numbers that matter. If your blood pressure readings are consistently at or above 130/80, that's it. That's the clinical line in the sand for a diagnosis. It's the main signal telling us that the pressure in the system is getting dangerously high. Okay, so where is all this pressure actually coming from? Before we get into the nuts and bolts, it's really important to know that hypertension basically falls into two main buckets. Now, what's kind of wild and a little frustrating for doctors is that for a staggering 95% of people with hypertension, there isn't one single obvious cause. This is what we call primary hypertension, and it's usually a complex mix of genes and lifestyle. Only that tiny 5% have a clear secondary cause, like a specific problem with their kidneys or something. All right, let's get into the mechanics of how this whole thing works. Because to really, truly get a handle on hypertension, you only need to understand one simple formula that basically runs the entire show. Okay, now I know this looks a little abstract, like something out of a physics class, but stick with me. This is the master equation. On the left, you've got blood pressure, and on the right, you have the only two things that actually determine what that pressure is. Let's break down what they mean. It really just boils down to two things. First, cardiac output, which is basically the flow, just how much blood your heart is pumping out. The second thing is systemic vascular resistance, which you can just think of as the squeeze, how tight and constricted your blood vessels are. So you increase the flow or you increase the squeeze, and the overall pressure goes up. It's that simple. And every single treatment we have is designed to target one of these two things. So now let's pop the hood and see what can actually cause these two factors, the flow and the squeeze, to get stuck in the on position and become way too high. When you get right down to it, there are a few key malfunctions in the body's machinery. Either the pipes, the blood vessels, are just staying too narrow, or a really powerful hormonal system gets overactivated, or the body is just holding on to too much fluid in the plumbing. So the first and most common problem is with the pipes themselves. They just get too tight. See, healthy blood vessels are supposed to be flexible because our bodies make this amazing molecule called nitric oxide. It's a natural relaxant. It tells the vessels to open up. But in a lot of people with hypertension, the production of this molecule goes down. And without that constant relax signal, the vessels just stay partly constricted, permanently cranking up the squeeze. Next up, we've got this incredibly powerful hormonal chain reaction. It's called the renin-angiotensin-aldosterone system, or RAS for short, but you can just think of it like a series of dominoes. And when this system gets overactivated, it's like a runaway train. The final domino, this molecule called angiotensin 2, is a real double whammy. It's one of the body's strongest vessel constrictors, so it jacks up the squeeze. And it also tells the kidneys to hold on to more salt and water, which, you guessed it, increases the flow. Okay, so if those are the problems, how in the world do we fix them? This is where modern medicine gets really, really clever. It brings us to the molecular toolbox we now have to manage hypertension. Let's start with that out-of-control RAS chain reaction, that domino effect. If you were a mechanic looking at this system, trying to stop those dominoes from falling, where would you step in? Well, here's the first tool in our toolbox, a class of drugs called ACE inhibitors. If you look at our domino effect, these drugs basically put up a shield, and they block the ACE enzyme. That's domino number 3. By stopping just that one domino, the whole cascade comes to a halt. And you can see in the table, this stops that final powerful molecule from ever being created, which brings down both the squeeze and the flow. Pretty smart. Now here's another tool called an ARB that's just as clever, but it takes a totally different approach. It actually lets that final domino, angiotensin 2, get created, but it puts a cushion in front of its target. It blocks the specific receptor where that molecule is supposed to deliver its message. So even though the molecule is floating around, its message is never heard. As the table shows, the end result is exactly the same: less squeeze and less flow. So what about fixing those pipes that are squeezed too tight? For that, we use something called calcium channel blockers. So calcium is the molecular signal that tells muscles to tighten up. This tool literally blocks the channels that let calcium into the muscle cells in your vessel walls. No calcium, no tightening. This forces the vessels to relax and widen, which directly and powerfully reduces the squeeze. And finally, to fix that problem of having just too much fluid in the whole system, there's a really straightforward tool called a diuretic. All it does is help the kidneys get rid of excess salt and water from the body. This lowers the total amount of fluid in the pipes, which, as you know, directly reduces the flow in our pressure equation. So with all these tools, how do doctors pick the right one? Well, as you can see here, it is not random. It's a very targeted choice based on a person's specific situation. So, for example, a patient who also has diabetes might get an ACI or an ARB to help protect their kidneys. An elderly patient might respond better to a calcium channel blocker. It's all about targeted, mechanistic medicine designed to fix the specific thing that's gone wrong. Okay, let's just zoom out for a second and look at the big picture. Because when you understand all this, it completely changes how you should think about hypertension. And this, right here, is the most important takeaway. Hypertension is not just a number on a machine. It's a complex disease of molecular signals, tiny ion channels, and hormonal pathways that have gone off the rails. That number is just the symptom of a much, much deeper issue. And that's what's so empowering about this knowledge. Understanding the specific mechanics of the problem is what lets us use the right tools to fix the underlying issue. It's not about just chasing a number down. It's about correcting a fundamental imbalance in the entire system. And that's what makes the condition manageable for the long haul. It's not just a static number anymore, is it? Now you can see it for what it really is: a little window into this dynamic, fascinating, and incredibly complex molecular process that's happening inside all of our bodies every single second.